Hi, my name is Roxy Martinez and I'll be doing a shift report today. So today our patient is a 21-year-old male. His current diagnosis is comatose. He was admitted in the ER with a glaucoma scale of a 3. A bystander found him wandering around in Waikiki and he called 911, and when EMT arrived he was comatose with a glaucoma scale of 3, and so they intubated him right away. When he was in the ER, his temperature was 108 degrees, and so they gave him cold saline. They noticed a bilateral facial twitching when he was in the CT scan. When he was in the MRI, they noticed a hemorrhagic contusion. He has no history of present illness, no medical or surgical history, no medication or family health history, no known allergies. He's currently full code, and we do believe he is homeless and a meth user. We do neuro checks every 2 hours. He does follow simple commands, and he's very strong on his left side, specifically his hand. He would squeeze our hands with his left hand whenever we ask him, and gives us a 2 with his left hand, but he's very weak on his right side. He's very agitated and restless. We did put him on restraints because he did try to take out his OGT2. He has inverted T waves. His blood pressure is 135/67. His MAP is 87. He's currently on CPAP. He has coarse crackles and white secretions whenever we would suction him. He did poop twice today and it was soft. He is currently on dialysis and he is anuric. We will try to extubate him later on and stop the dialysis, and so right now he's currently NPO. His skin is dry and intact, and he does have a rash on his groin and his buttocks. His white blood cell was 21.0. His neutrophils is 89.3. His sodium is 145. Potassium 7.0. Magnesium 2.9. CO2 18. Glucose 146. BUN 26. And creatinine 3.24. And he's currently on dialysis, specifically CRRT. He has acute kidney injury, and he currently calcium is 10.1, protein 7.8, albumin 4.5. Some of the medications he is currently taking is acidophilus 1 caps a day, carvedilol 6.25 milligrams, chlorhexidine for oral care, lacosamide 100 milligram per 50 ml IV, Keppra 500 milligrams twice a day, Zosyn 12.5 ml per hour, quetiapine 25 milligrams. For some of the as-needed medications that he is taking that you should know are fentanyl injection sublimase 12.5 micrograms every 15 minutes, glucagon 1 milligram as needed for hypoglycemia, lidocaine 0.1 ml intradermal as needed, naloxone 0.4 milligram IV, nitrostat 0.4 milligrams sublingual every 5 minutes, potassium replacement scale, injection 20 to 40 mEq as needed for hypokalemia, sodium citrate IV 1 to 1.5 ml as needed to discontinue the CRRT, and NS Prisma hypertension emergency as needed for 100 ml. So hopefully we'll be able to extubate him and stop the dialysis, and I hope he does well. Thank you so much.